Hi, future nurses. Welcome back. Today's topic, perioperative care, the care before, during, and after surgery. This is a huge topic for the NCLEX and real-world nursing, as it's all about keeping patients safe and promoting recovery. We'll use the ADPIE framework, assessment, diagnosis, planning, implementation, and evaluation to break it down, plus some hints for exam prep. Let's get started. First up, assessment in the preoperative phase. This starts when the patient decides on surgery. Your job, gather a thorough history. Ask about age, allergies, especially to iodine or medications, current meds, including herbals, and past surgical or anesthesia experiences. Don't forget tobacco, alcohol, or drug use, and check their understanding of the procedure. For example, a 65-year-old patient with COPD is at higher risk for pulmonary complications, so note that. You'll also ensure the preoperative checklist is complete: signed consent, marked surgical site, vital signs, labs like hemoglobin, and skin prep. Surgical care improvement project protocols kick in here to prevent infections and complications. If you see an elderly patient with uncontrolled diabetes, think increased risk for wound infections. Moving to diagnosis. Based on your assessment, identify nursing diagnoses. For a patient with a history of heart failure, you might use risk for ineffective tissue perfusion due to potential intraoperative blood loss. Or, for an obese patient, risk for impaired wound healing because excess weight stresses incisions. Consider risk factors like dehydration, malnutrition, or medications like anticoagulants, which can cause bleeding. For example, a patient on warfarin needs careful monitoring to avoid hemorrhage. These diagnoses guide your care plan, so think critically. Now, planning. Set measurable goals to keep the patient safe and comfortable. For example, the patient will maintain stable vital signs intraoperatively, or the patient will ambulate within 12 hours post-op to prevent thrombophlebitis. Prioritize SCIP core measures like infection prevention with prophylactic antibiotics or venous thromboembolism prevention with sequential compression devices. For a same-day gallbladder surgery, plan to educate the patient on NPO rules and post-operative activity. Clear goals keep everyone on track. Time for implementation. In the preoperative phase, educate the patient about NPO rules, jewelry removal, and what to expect in the PACU. During surgery, the OR nurse ensures a sterile environment, verifies the surgical site, and monitors for excessive blood loss. Post-op, in the PACU, you're checking vital signs, O2 saturation, and dressings for bleeding. For example, use heated blankets for warmth. Administer IV analgesics for pain, but always check intraoperative meds with the anesthesiologist first. Encourage deep breathing with an incentive spirometer to prevent atelectasis. Every action ties back to safety and recovery. Let's wrap up with evaluation. Are your interventions working? Check vital signs. Are they stable? Is the patient's pain controlled with PCA or IV meds? Look at the incision. No redness or drainage? Great. Monitor urine output to rule out retention, and ensure the patient is ambulating as planned to prevent clots. For example, if a patient's O2 saturation drops below 92%, reassess respiratory status and notify the provider. Use a PACU scoring system to confirm the patient's ready for discharge to a general unit. Always document outcomes. All right, let's talk NCLEX strategy. For perioperative care, prioritize patient safety. If a question asks about preoperative care, focus on verifying consent and marking the surgical site. For post-op, think ABCs: airway, breathing, circulation. A classic NCLEX question might be, a patient is 6 hours post-op and reports nausea. What's your first action? Answer: position them on their side to prevent aspiration. Hint: memorize surgical care improvement project protocols, antibiotics within 1 hour of incision, and sequential compression devices for clot prevention. If you see a patient with hypothermia post-op, think warm blankets. Practice questions like, what's a sign of wound dehiscence? Hint: separation of wound edges, especially in obese or diabetic patients. That's a wrap on perioperative care, nurses. You've got this. Keep studying smart with ADPIE. Check the description for resources, and don't forget to like, subscribe, and hit the bell for more NCLEX prep. See you next time.